everyone. Sorry. Can you hear me, Dr. Abi?
Yes, doc, we can hear you. Yes, you're completely audible. And I guess you are my voice is also clear, right?
Sorry?
My voice is also clear for you, right?
Yes, very clear.
Yeah, okay. I think we'll wait for some more time, maybe 3, 4 minutes. We'll wait for some more participants to join that meeting. I mean, join the webinar. We'll give some more time. Yeah.
Okay, good.
Okay. Okay.
Yeah.
Please start. We are waiting. Hello, everyone. So I think we'll start, Dr. Ebenezer. So number of participants are there almost. So we'll start. Let other people also join in the once we start, let others also join after that. So I'm audible, right, doctor?
Yes, you're audible. Just
Okay.
listening.
Okay. So, good afternoon, everyone, and a warm, very welcome to all of you. So, on behalf of Ashish Life Science Private Limited, I would like to thank each one of you for joining us today for this knowledge-driven webinar on Udder Health Care and Management. So, it's truly encouraging to see participants joining us from different regions and professional backgrounds. So, let me introduce myself. My name is Dr. Abhijit Das, and I'll be moderating today's session. So just before going to a presentation and going to a webinar, I'll be introducing our esteemed speaker. So it is my absolute pleasure to introduce our main speaker, Dr. Ebenezer Tesfaye, a highly accomplished veterinarian with extensive field, farm, and project experience across Ethiopia and international platforms. Dr. Ebenezer is a graduate of Addis Ababa University College of Veterinary Medicine. He began his professional journey with an NGO where he worked for 3 years as a program manager in a spay neuter release program, gaining strong exposure to population health management and field operations. And he then moved into commercial livestock operations, working for 2 years as a livestock supervisor at Verde Beef Processing PLC, a state-of-the-art feedlot operation in Ethiopia. Then subsequently, he served for 3 years as a herd manager at Alpha Fodder and Dairy Farms, a large Dutch-owned dairy farm, where he was deeply involved in udder health programs, herd productivity, and on-farm management systems. And also, Dr. Ebenezer played a critical role in contract farming and export-oriented livestock projects as the livestock herd of department at Luna Export Abattoir, working on projects funded by prestigious global institutions such as the Bill and Melinda Gates Foundation and the World Bank Group. In addition to his rich field experience, he has received specialized international training in Belgium and Tanzania, conducted by Zoetis, with a strong focus on udder health and from both economics and farmer-centric perspectives. And currently, Dr. Ebenezer owns and runs his own veterinary service, the V Care Veterinary Service, where he works as a senior veterinarian and providing practical, result oriented solutions to farmers and dairy enterprises. With this unique blend of academic grounding, large scale dairy exposure, international training, and real world economics, we are confident enough that today's session will be both practical and highly insightful. So, just before beginning the session, just a session notes to our participants. Before we begin, all participants will receive an e-certificate of participation after completion of this webinar, and also three lucky winners will be announced at the end of the webinar. So, only if you have the 100% throughout the presentation, if you are or throughout the webinar, if you are present, then only you will be eligible to be selected for the lucky winner. So I kindly request everyone to stay till the end of the session and actively participate in the discussion. So first, Dr. Abhinesar will be explaining and he'll be going through his presentation. So at that time, meanwhile, if anybody wants to ask some questions or if you feel doubts on anything, you can ask that questions in the chat box. And once the session, once we finish with the session, so after that, we'll be having a question and answer discussion. At that time, we can discuss on all those sessions. So everybody, please stay active and please stay till the end of the webinar. So with that, I would now like to warmly welcome Dr. Abhinezer and invite him to begin his today's session on Udder Healthcare and Management. So over to you, Dr. Abhinezer.
Thank you, Dr. Abid. Thank you for the nice introduction. If I had done it, I wouldn't do it like you. So thank you very much.
Fine, thank
So,
you. Welcome, Doc. Yeah.
okay. So today basically we'll be focusing on Udder Health and also its management, plus practical experiences that I have encountered on Udder Health, working on dairy farms and also consulting dairy farms in Ethiopia. So we'll have different participants in this webinar. Some of them are professionals, some of them are not professionals, maybe. So I hope I make it clear to everyone. That's um, I'll start sharing. Okay.
Yes, Doc.
Yes, Dr. Abid, if you can allow me to share for the
Yeah,
webinar.
yeah. Sure, sure. Yes, Doc. You may share your screen now.
Is everything visible? Just asking.
Yes, Doc. Yes, Doc. Everything is visible.
Right. Okay. Um, right. Is it in presentation mode?
Yes, Doc. It's in presentation mode. Complete screen is properly visible and your slide is also properly visible.
Okay. Well, I don't seem to see it, so I'm trying to arrange that one.
Are you not able to see that on your screen?
Yeah, that's what I'm trying to.
Okay, so here we can see it properly.
Okay, then I can just okay, good. I can see it now. All right.
It's okay,
Just
Doc. Now you can see it, right?
yes, I can see it. So
Yeah.
you can hear my voice loud and clear.
Yes,
If
everything
you
is
have
clear.
questions, just don't mind interrupting me in between. So I'm going to begin with. So when we're talking about dairy farming, we need to always focus on the udder health, basically. So that's why I chose this topic to discuss because it's the sleeping giant that we haven't focused on. So dairy cattle are assets when looking from the farmer's perspective or from the national perspective. It's an asset that you have in your stables or in your pen, but we always tend to focus more on feeding and more on production, but also less on. I'm not talking maybe in many contexts of other countries, but in our country context, especially in sub-Saharan Africa, this is the main challenge that I have observed and also discussed with colleagues from Kenya, Uganda, Tanzania, and many other sub-Saharan African countries. So basically, if there are attendees here that are joining from there too, they can be part of this and also part of the solution. So we're not going to give, in this webinar, we're just going to have an eye opener and also what can we do to manage this udder health. So we'll be assessing the impact on production, fertility, and economic viability in herds when we're talking about udder health. So you can have a cow, but a cow without udder is just nothing. So that's why we focus on the udder. So my name is Dr. Ebenezer. I'm from Ethiopia, as Dr. Abid has already explained about me. This is the company that I own currently. I've been working for over 12 years in the veterinary sector and in different fields, feedlot, spay neuter, dairy farming, and also with a little experience in poultry farming. So that said, so this is where we see the udder anatomy and the defense line. So from a dairy farming perspective, the udder is it's the basic engine of the farm. So when you have a farm, the main part we focus from the cow is not the body only, not the digestion system, but majorly it's the udder. So why we focus on the udder is it's just more than a milk storage bag. It's the highly specialized organ whose health, structure, and efficiency determine profitability, sustainability, and the entire dairy operation. So the cow without the udder or the four quarters functioning is useless. So that's why we focus on this. So when we look at the udder, there are different parts that we can see. And why we call it the first defense is because the teat canal with the ductus papillaris is the first line of defense, just the same as the skin. And also during the dry period, there is the keratin plug. And pharmaceutical industries like Zoetis and other companies also, we were talking with Dr. Abid about producing dry off therapy, producing this sealants that can be used as a keratin plug in cases of failed keratin plug production in dairy cows. So that's the keratin plug. It's a wax-like production that's produced so that bacteria cannot enter the udder. And also we have the Rosetta of Furstenberg, and this is where a kind of foldable anatomical structure that's in the gland cistern. And then when we see that organ, it's actually where the bacteria faces the most challenge from the leukocytes and where defeat or mastitis happens. So either the leukocytes clear out the bacteria or the fight in between creates a kind of pus-like or flake-like milk production. So just observing the anatomy. So why talk about mastitis? What is mastitis? So mastitis for many of us, it's just a swollen udder where we can just put intramammary tube. So it's an inflammation of the udder. Basically, the definition is just inflammation of the udder, but it is a complex multifactorial disease of the mammary gland, primarily driven by the interaction between microbial pathogens and host immunity and environmental management. So these are the things that affect the udder health, and one of the udder health diseases is mastitis. This is the major thing that we'll be discussing about. So we discussed on the anatomy and the defense, and then mastitis happens when these defense lines are broken and the teeth canal defenses are broken and the teeth sphincter access. So this is where the disease happens. So the bacteria or the pathogen from the environment or from the skin or from the milker's hand is entering into the teeth canal and then enters the gland cistern. So majorly in our country, people when the cows give them a hard time to milk, they feed them while they're being milked. So they forget that they're being milked, so they behave during milking. So this creates, as you can see, the teeth canal cannot be closed from 30 to 60 minutes. So if they're eating while they're actually being milked, and then when they're done with the food and when they're done with the milking, they go back and sit in the mud or in the in the dung itself, or in the barn. Then the teeth canal is open, so it gives access to bacteria to enter into the teeth canal. So to just highlight on that, we always need to make sure that the animals are not being fed, but being fed after milking. Yeah, we have to habituate them into being fed after milking because it takes 30 to 60 minutes for the teeth canal, which is the first line of defense, to close to close itself and protect the udder from being infected. So once the bacteria enters, they have to survive the host innate immune system. So these are the leukocyte response. So leukocytes, basically the PMNs, the polymorphonuclear neutrophils, are gathered there, and then this creates a kind of a rise in the somatic cell count. So then loss of premium milk and loss of milk, which we'll be discussing in the long run about subclinical mastitis. So greater than so there's the somatic cell count threshold that is actually good with no milk loss is less than 100,000 somatic cells per microliter. So if they pass that, if it's greater than 200,000, then there is a probability of clinical and subclinical mastitis. So this is so the clinical mastitis, when we're talking about the clinical mastitis, the causes are two types. So the infectious causes, mostly 95% are bacteria, and the rest of the 5% is yeast, fungi, and Prothetica species. And the non-infectious diseases are teeth lesions. Basically, when we talk about teeth lesions in Ethiopia, in sub-Saharan Africa, it's not trauma based. It's actually most of the time, from my experience in alpha fodder and dairy farms, is that teeth lesions happen because of FMD. So the foot and mouth disease affects the teeth tips. So then the teeth tips are broken, and then bacteria enter through those teeth tips with the lesions. So control of FMD in most scenarios brings about control of mastitis. So the other is a chemical use that we use post dipping and pre milking dipping. So see, these dips, if the chemicals are not properly uh, properly prepared according to the concentration standards, then these can cause also, for example, iodine. Excessive use of iodine also causes dryness in the teeth. So that causes lesion during the milking, and then The other thing that happens after that is the teeth canal is broken. So also on the teeth lesions, when we're talking about teeth lesions on non-infectious diseases, it's also the vacuum dry milking. So if we leave the vacuum there for more than I think 10 to 15 seconds without milk, if it's just milking it, then it breaks the teeth tips. So if uh, that happens, then there is lesion, bacteria entry is inevitable. So these are some of the causes of mastitis. So what happens during mastitis is um, the germ enters into the bloodstream, and then the production of cytokines, and then chemotaxis neutrophils. Then that's what we said about the PMNs, or the polymorphonuclear neutrophils appear in the bloodstream or in the milk itself. So that's what we see. So mastitis and its symptoms. Clinical mastitis is categorized by visible changes in the milk and the udder, often classified into three grades of severity. Grade one is mild, changes only in the milk. This is clots, flakes, or watery appearance. And the grade two is the moderate one, changes in the milk plus local inflammation of the udder, redness, heat, swelling, and pain during touch. So that's the grade two. And the grade three is severe or systemic. So all of the above plus systemic signs, fever, loss of appetite, rapid pulse, dehydration, and in severe cases like E. coli, downer status, or death. So if there are dairy farmers and also veterinarians in here, who are listening to this webinar, for me, I think most of the cases, the grades that appear here, I have seen them practically, and including the grade three, systemic, and also cows going into shock and death due to mastitis. So this is what happens when we see the mastitis. So when we see the clots and the flakes and the watery appearance, we have to milk it properly, even if it's painful a little bit. So then we have to give them intramammary injections. And not necessarily during the mild one, you cannot see any swelling on the udder itself, on the quarter itself. So it's always mandatory during milking to check the first two, three strips have to be checked before putting on the machine or milking the animal. So these are the mandatory things that we need to do on the mild ones to find out the mild ones. The moderate ones, we can easily see it. It's painful. There's swelling. There is color change in the other quarter, which is affected. So in the third one, all the signs that we see above, including sometimes blood in the milk itself. So that's plus, the animal runs into kind of systemic bacterial infection. So this happens during E. coli infection, which causes downer or death, or sometimes shock into the animal and collapse. So the earlier detection, the better treatment. So probably you will find this PowerPoint from Dr. Beat, maybe, or the video. So you'll have these great clinical mastitis symptoms, severity, and grading system, the picture. So this as the this is just a grading system that we use to see the moderate, the mild, and the severe mastitis cases. So, okay, great. Okay. So, am I still audible? Can Dr. Beat confirm with me?
Yes, yes, doctor, you're audible.
So categorizing the mastitis causing pathogens, we can use three mechanisms. So the cell wall and the damage, plus the ecology and the epidemiology of the pathogen itself. So when we say cell wall, there is a gram-positive bacteria and there is also a gram-negative bacteria. And when we say damage, there is a major pathogen and there's a minor pathogen. And when we say ecology and epidemiology, is it contagious pathogen from other animals or from hand contact, for example, milking from what I have seen in my country, milking is done mostly in rural areas by hand. So if the hand is not properly sanitized, then transmission becomes also contagious by contact. And then environmental pathogen. So we can categorize them in three. This is just a simple categorization. So you can have different ways of categorizing the pathogens, but this is what I have. So the gram-positive, the contagious, and the persistent, this is what they're called. So these pathogens typically cause chronic or long-lasting infections because they are experts in hiding from the immune system. So I think professionals mostly know this bacteria when we're talking about mastitis. You can say it for yourself, and then when you see it, then you'll understand which bacteria I'm talking about. So why the gram-positive? So the gram-positive, the cell wall has, I think, peptidoglycans. 50 to 90% of the cell wall is covered with this peptidoglycan layers. So when we stain them, we see crystal violet on gram staining. So that's why we call them the gram positive. So then the pathogens that you see here, for example, Staph aureus, Strep agalactiae, and Strep ubris, these are the pathogens that are categorized in gram positive. So primary virulence factors for Staph aureus is a protein A capsule, alpha and beta hemolysins, and biofilm formation. Most importantly, the biofilm formation is one of, I think, the challenges that uh, to control the Staph aureus because currently the Staph aureus has the major damage that comes from mastitis comes from Staph aureus because it has a biofilm. So when we are using antibiotics that are intramammary infusions with, I think, um, most likely amoxicillin, clavulanic acid, and anti-inflammatory, when added together, can bring a good result in, killing the biofilm first, then actually affecting the bacteria itself with the antibiotics. Otherwise, we cannot reach the bacteria. So these are the one of the smartest and the persistent pathogens in the category. And there is the Strep agalactiae, the CAM factor, a pore-forming protein that destroys host cell membranes and then enters into system. Then there's Strep ubris, the adhesion molecule, and then helps the bacteria stick to enter the mammary epithelial cells, mimics host tissue to cloak the bacteria. That's the hyaluronic acid capsule. So these are the gram-positive pathogens. So I think, sorry for the slide mistake here. It was supposed to be G minus. So just correct it later. So the gram-negative pathogens are environmental and
When we share
acute.
this presentation with everyone, that time we can correct and share it, doc.
Yes,
That is
yes.
fine.
We can just keep it like this now. So these pathogens often cause sudden severe toxic mastitis. So these are the ones that we were actually talking about when we said they lead the animal to shock and death. So they cause downers. So they're very acute. You don't see them if you don't observe the herd properly. So that's why when we are actually assessing herd in numbers. Like for example, let's say above 50 or above 60, we have to see everything. So basically, including when we say we have to see everything, the udder we have to see always during milking. If it's twice a day, at least once a day, the udder has to be checked, and also the teats have to be tested for 4 or 5 strips to see if there's flake, pain during touch. So we have to always keep our eyes open. So most of the time when we see uh, downers, we don't think that as professionals, we don't think that mastitis is the cause of death. So we think something else is behind it. But most of the time, from my experience, I have seen practically mastitis kill cows. And like as a vet on site, we always teach our assistants to help us identify animals. And also during milking, we're always there. So it was a 3-time milking in a day. So during the 3 times, one of the times I'm in the milking parlor checking every udder, and if there's pain, we identify with ear tags, and then we separate them. So most of the time, these acute ones, when we're on off days, for example, on Saturday to Sunday, we don't work. So like Saturday afternoon, sudden pain, and then no one reports it, and then you find the animal dead on Monday. So basically, those are um, the cause of death also. So it's one thing is that we lose the milk. The other thing is we also lose the animal. So maybe if it's early lactation, then we also lose the calf, because if we don't have enough colostrum for the calf or milk for the calf, then also that's a loss. So why these pathogens are like this is because they're made up of lipopolysaccharides. Their cell walls are made up of lipopolysaccharides and containing a substance called endotoxin. So these pathogens attach the cell wall, and then they break the cell wall, release of endotoxin, severe inflammatory reaction, fever, then shock. So when we're staining them, they either stain red or pink in color during the gram stain. So then the other category of the pathogens is the harmful or the major pathogens, and the less harmful and the minor pathogens. So in the harmful, you can see Staph aureus, E. coli, Klebsiella, Strep uberis, Strep agalactiae, and also Strep disgalactiae, sorry. So, and in the minor ones, you see the non-aureus staph species and the Corynebacterium bovis. So these are the categorization forms. So what determines the severity of mastitis? So there are multiple factors, multiple players that determine uh, the severity of mastitis. So one is, like we mentioned earlier, it could be the type of pathogen that's involved in the mastitis. One, maybe we're not able to intervene with the mastitis in case of Staph aureus if we're not using the proper intermammary injections, intermammary infusions, then we might lose the opportunity to actually eliminate the bacteria, and then it can cause a damage to the other finally untreatable level. So the risk with the other is that you cannot fix anything once the disease has progressed into a chronic level. You might show some recovery, but the recurrence causes also the environmentally they become the reservoir for Staph aureus, because we think they're healed, and then we milk with the same hand, and then we milk the healthy ones, and then we transmit the bacteria into the healthy ones. So that's the type of pathogen involved also determines the severity of the mastitis and the infection pressure, the number of the somatic cell count, or also the number of bacteria that are actually multiplying, and the immunity of the cow. To, to, to determine the immunity, we work on the feed, because the feed needs to have a lot of nutritive value feed. We need to feed them those kind of feed. So then if they're being fed healthy and then their immune system is higher, especially vitamin supplements and all those things, then these actually support them in fighting against mastitis. So these are the factors that determine the severity of mastitis. So so mastitis, the advantage about mastitis, the clinical mastitis that we discussed earlier, is that we can see it. As vets, we walk in the farm, we look at animals, we stand in the milking parlor, and then we can see the actual clinical signs. And then we can say, okay, we need to treat these animals, and then withdraw the milk, and then until they recover, we give them the intramammary infusions. We have those intramammary infusions. I think you know the Ashish products in the catalog. You have seen them in Ethiopia. I have seen many of them. So you can see those products. You can use those products. But since, like earlier treatment and prevention is much more better, we don't recommend the treatment because, treatment, if interrupted, is going to cause drug resistance and all those things. So the advantage to the clinical mastitis is that it's visible to the vets, to the farmer, so that we can intervene with products available in the market. Now we're going to see the subclinical mastitis. So what is subclinical mastitis, and what is the difference between the two? So we're going to see those, and we're going to actually see the impact on production, fertility, economic viability in herds. So this is also the thing that we, as vets, for me, subclinical mastitis, I learned a lot about it in Belgium, in Tanzania, and also I started reading about it because once I learned about it, then I wondering what happened to the milk production, because I remember in alpha fodder and dairy farms, well, while I was the herd manager. So there was a drop from 4,500 liters per day to 1,200 to 1,800. The nutrition was okay and everything was being monitored, but we have the level somatic cell counter, but we didn't do it regularly because of the cassettes. So maybe that's where we failed. So we didn't know why the milk was dropping down, but also the milk quality was being reported back and saying like, you guys have a lot of somatic cell count, you have a lot of bacteria in your milk. It's not as pricey as it was supposed to be. The premium packages were broken, and then so we have to do some adjustments. So an eye opener in that process is that what I learned afterwards is that the subclinical mastitis. So what is the subclinical mastitis? So it's this one, like I said earlier, you don't see anything. So this is also called the invisible thief. So you don't see actually the actual clinical signs. There is no clinical sign. There isn't change in the milk. It's just normal. Everything is okay, business as usual. And then you have the subclinical mastitis. So this is no visible sign. Udder and milk appear completely normal. It is the most prevalent and costly form of mastitis. So the clinical mastitis, you can easily target it, find it, and then treat it and save the animal, also the milk. But when we come to subclinical mastitis, you cannot find it unless you do a proper search using different methods that we will see in the future slides. And then it's a very costly one because you don't know what's happening in the herd, and then it's actually damaging your herd and the milk production in the herd. So this affects different things. So the detection is by numbers. So it's the only detectable via testing. The primary indicator is an elevated somatic cell count, typically defined as greater than 200,000 cells per microliter. So it is 15 to 40 times more prevalent than clinical or visible mastitis because the clinical, you can see it, treat it, prevent it. But this one is more prevalent because we don't see it. We don't control the transmission. We don't see where the gap is because it's just there, and it's just we're losing money every single day, every single milking. So uh, that's what makes these subclinical mastitis very difficult. So there are three pillars to this. The three pillars of damage for subclinical mastitis are production, fertility, and profit. So we'll see each one of them, just like we did in clinical mastitis category. We'll see also these ones. So key area one of the loss is the damage to sorry.
Hello,
Okay.
Doc. Yes. Hello.
Yes, my video is off.
Yes. Now your video is off. It was stuck in between,
Okay. Mm.
but you're audible, doctor.
So let me continue with the video off, and then maybe you can just okay. I'll fix it late a little bit later. Um, Now I think you can see me.
Yes. Now it's clear, doc.
Good. Okay.
Yeah.
So the key area one that we'll see is the production. So 2.5% milk loss will happen if we have somatic cell count higher than 200, and then it continues. We'll see a graph where even we have a lot of loss, a lot to lose when we have um, the subclinical mastitis. So this happens due to damage to secretory tissues. So it causes a chronic progressive damage to the milk producing secretory tissue in the udder. This damage is often permanent because, as you can see from the anatomy of the udder, the alveoli that actually pump are uh, uh, surrounded by myoepithelials. So these epithelial cells produce the milk, and the myoepithelial cells that are surrounding the alveoli are actually pushed by oxytocin, and then they release the milk. So these subclinical mastitis pathogens, they enter into the system, and then they progressively destroy, cause damage to these organs in the parenchyma, and it's not surgically treatable. We were even given a challenge when I was in Alpha Fodder and Dairy Farms to save 3/4 by cutting out the rest. I mean, one of the quarters that was actually broken. Oh, the healing was the hardest part. So the parenchyma tissue doesn't heal because there's always milk secretory tissues in there, and once you stitch them, they don't actually heal. So basically, that's one of the challenges that we face. So they cause the damage, and the damage is permanent. You cannot actually cure it 100% once the damage is done. So research shows that 2.5% drop in milk yield for every 100,000 cell per microliter increase in somatic cell count over 200,000 cell per microliter threshold. So a cow with a chronic somatic cell count can lose over 182 liter of milk per lactation. So we're talking about the same thing. It's mastitis, but there is a clinical one and there is the subclinical one. So the clinical mastitis is visible. You can see that it's not only affecting the udder. You can see visible clinical signs, but here you cannot see anything. There is no flake in the milk. The milk is normal, but when you do the numbers, then you see somatic cell counts. These are actually the ones that we mentioned earlier, the polymorphonuclear neutrophils that are actually called to fight the pathogens. You find them higher in number in the milk while doing different kind of testing. So you'll see the somatic cell count increasing higher. So due to this, one cow can lose 182 liter of milk per lactation. You can calculate, you can do the math and the loss. At least this could cover for some cow feed that we can present into the farm. So visualizing production loss, for example, less than 100,000 is 0 kg loss, and 200,000 somatic cell count gives you 1.5 kg per day, and moderate somatic subclinical mastitis. Also, this is the moderate one, 400,000. This gives you 2.5 kg per day of loss. And this, you can do the math and turn it into liter. Severe subclinical mastitis, 800,000, you can lose up to 4 liters per day or 4 kg per day. So this is the visualized production loss in dairy due to subclinical mastitis. So key area 2, damage to fertility. So increased days open. So subclinical mastitis causes inflammation that disrupts hormones. Studies show that subclinical mastitis cows can have 35 plus more days open. Example, if you can have an animal. So during working on a dairy farm, you have to be really critical about the cleanliness of the uterus, the cleanliness of the udder, plus the animal or the cow has to be ready for mating within the 60 days. The first 60 days, she has to be served with a bull or AI,
Hello.
and then be ready for, sorry? Is there any question, Dr. Abi?
Nothing, doctor.
Okay. So this increases. So increased days open means, so during the dry off, we're gonna have 3 months of resting. So instead of 2 months of resting, because the animal wasn't properly served, so fertility became interrupted because of the inflammatory reaction. So anti-inflammatories cause actually disruption in the uterus. So also egg ovulation is affected. So all these things happen at the same time. So lower conception rates, even if there is heat signs, the inflammatory state significantly reduces the probability of conception, especially when subclinical mastitis occurs near the same time of artificial insemination or bull service. And most services per consumption, you can see the subclinical mastitis has 2.5 services versus 1.6 in a healthy herd mates. And then not only this, without knowing this, we consider the animal is actually not getting pregnant. And then we decide to cull that animal instead of to resolve the problem with the underlying subclinical mastitis issues. That can actually last in some animals up to 6 months, you will not have pregnancy. And then at the end, when you check for pregnancy, you have them. So this is uh, due to chronic unresolved subclinical mastitis that happens here. So the fertility mechanism is a systemic issue. So how subclinical mastitis harms fertility, the damage is not just in the udder. The inflammatory mediators, cytokines and bacterial toxins, endotoxins, like the ones that we mentioned in clinical mastitis, from the infected gland enter the bloodstream. This systemic inflammation disrupts the delicate hormonal balance between balance between hypothalamus, pituitary, and ovary. So these are related because the hypothalamus produces the GnRH, the gonadotropin releasing hormone, and then the pituitary produces the FSH and the LH luteinizing hormones. And these actually activate in the ovaries the estrogen and ovulation. So due to the cytokines, the endotoxins that are produced by the pathogens causing the subclinical mastitis, this axis is actually disrupted. So there is no normal stress, the estrous cycle. There is no successful ovulation. And then oocyte or egg quality is compromised and implantation of the embryo. Because, for example, one of the reasons that dexamethasone is actually forbidden to be used in pregnant animals is because it actually causes abortion. So the anti-inflammatory reaction and the inflammatory reactions produce the same effect, and embryo implantation becomes a challenge. So this is one of the causes of so production loss plus profit loss. Many people complain about dairy farms not producing properly. She used, like, for example, some of the farmers that come to my clinic, they mentioned like she used to produce a lot, now she's producing less. And to intervene, you have to actually do the diagnostics. So when you do that, you find out that these animals have actually subclinical mastitis. So this is one of the challenges that it's the I think it's the giants that we never spoke about in because we're vets, we're supposed to see clinical symptoms, not the hidden things, because we're not wizards or we're not some kind of uh, magician to detect those things. We were trained, equipped to see the clinical signs, to listen to the story, and then actually come to this thing. So to do that in subclinical mastitis, there isn't a story behind it. So mostly, I would say, like, for example, if a veterinarian hears that my cow is not conceiving, she comes into heat, that there's no conception, I would do a somatic cell count and then define if there is, like if there is a moderate or severe subclinical mastitis in the animal, then decide first to treat the subclinical mastitis and then to go for like the fertility again. So we can find these, and especially to fight subclinical mastitis, we should do it on the dry off period. We have to treat the animals with dry cow therapy so that the antibiotic is sealed with the keratin plug once we put it in, and then the keratin plug produced in the teat canal actually plugs it and keeps it there. It doesn't come out. So stays for 60 days at least. So, and then with that kind of dry cow therapy and maybe we can control the subclinical mastitis, because it's very crucial to control it after after dry off period. It's easier to control it because we don't contaminate the other milk, and also we don't put the animal in stress their resting period. So during that period, we can actually actually tackle some of the subclinical mastitis problems. And some, in severe cases, we have to treat it just as the clinical mastitis so that the bacteria clears out and the somatic cell count goes down. So, and one of the reasons this actually damages a lot is because it reduces milk production. For example, if we see a higher somatic cell count in the herd and then decide to treat all the herd, or selective treating by taking every single individual animal and then finally deciding to treat it, that means we dump a lot of milk due to withdrawal period. So most of the time, we decide to keep milking um, until the dry off period. But from my perspective, that actually causes a lot of damage to the animal and also to the udder itself, damaging future production and also damaging the fertility and the animal's health and the egg quality. So all those things are affected. So it's better to treat them right away, selective treating, and considering the future to make the future better, the future of the herd better. It's better to treat the animals right away. So key area loss is the economic damage that it brings to the herd. So lost milk sales, the largest single cost. This includes direct production loss, 78% of the costs, and potential loss of milk quality premiums. So, for example, in Ethiopia, we don't have milk premiums, but if there is a somatic cell count higher than 200,000, the milk is not sold as premium milk. It's sold as just normal milk. And then when it's more than 400,000 to 800,000, and the milk is returned to the owner in some countries. Even in some countries in Africa, this is a major selling point. So they're actually working towards improving the subclinical mastitis challenge that they're facing. So they're using different kinds of products in those countries to actually treat the subclinical mastitis earlier and produce a premium quality milk. And treatment and vet costs for diagnostic, for example, SCC or somatic cell count testing, increased use of antibiotics, especially at dry off, and veterinary consultation to actually challenge and tackle the problems. These are some of the challenges that we actually face. So this is one thing that we really need to work towards to minimize the treatment and vet costs at any time. So the other thing that I mentioned also earlier is the culling and replacement. So due to infertility caused by subclinical mastitis, we cull high number of genetic merit to cows due to chronic high somatic cell count associated with reproductive failure. So this accounts for around 14% of the costs. So this is where the economic effect is visible. So the mastitis iceberg is that the subclinical mastitis or the hidden thief costs around 75%, and the clinical or the visible one costs around 25%. And just to give you a highlight, the majority of economic losses are hidden. So the US dairy industry loses over around $1 billion annually to subclinical mastitis alone. This is an experience I was shared and that I'm sharing with you. So where do we need to work to control and prevent? So milking routines, health checkups. So these are the things that we really need to work towards, like managing the dairy industry. Any pharmaceutical industry is not interested in just injecting and selling its products only. That's why we're here today. We're not here only to talk about products. We're here to talk about the challenges that the farmers are facing. So we really need to control the bacteria, the mastitis, the routines. We need to have standard operational procedures in place so that we can have a better udder health in our herd. And then, if need be, when products are in need, here Ashish Life Science can provide the products here, and then we can use those products so that we can tackle the problems that we're facing. So one thing is that we really need to monitor the regular SCC testing. So individual plus bulk tank needs to be tested to identify high-risk cows and herd status. When we do bulk tank, we check the herd status. If it's less than 200,000, it's fine. If it's greater than 200,000, we really need to do selective individual SCC testing to, the ones that we suspect or the reservoirs that we suspect. So the other thing is hygiene, strict pre and post milking teat dipping protocols and proper milking procedures. Most of the time, when people are milking with hands, they wet the teats with the milk itself so that it becomes smooth for milking. So those things can actually be very good access to bacteria entry. So once we do that, washing between milkings, washing between intervals, and milking mastitis animals or mastitis carriers or sick animals last. These are some of the procedures that we can put in place and then prevent mastitis. And environmentally, providing clean, dry, comfortable bedding to reduce pathogen load. Like I said earlier, we really need to habituate our animals or our cows to actually be milked first and then given feed after, instead of giving them feed during milking, because the teat canal doesn't close for 30 to 60 minutes. We need to feed them 30 to 60 minutes and give them water afterwards. Then we can actually tackle the problem, because then the teat canal closes. If they sit anywhere, it's fine. So we can do that. And then comes the dry cow therapy. So using selective or blanket antibiotic therapy, a dry off to cure existing infections. So when we dry off, I don't think we have it here in Ethiopia, but in many countries, they do have dry cow therapy. And this is maybe during the discussion, I think the Ashish Life Science team can also assist me here in kind of introducing the dry cow therapy into Ethiopia, so that we can actually prevent the subclinical and the clinical mastitis during the dry off period to minimize economic losses at that time. And culling, this one has to be actually connected to data. So making data-driven decisions to remove chronically infected high somatic cell count cows that do not respond to treatment. So this is actually connected to many things. In the dairy industry, data is the most important thing. So we really need to keep record of all the animals and their history of treatment, their history of clinical mastitis, and their history of any other treatments that they have taken, any other sicknesses that they have faced. All those informations need to be recorded, including which quarter was affected. The first, the second, the third, on the right, on the left, on the back, on the front. So these are the things that we really need to work towards, because to improve dairy herd health and udder health, we really need to decide based on data. If there is no data, then there isn't, like a way of culling the animal. Oh, because the redundancy of treating the animal, recovering, treating the animal and recovering again and again. If the animal has gone through 3-4 times, and then it should be done. And it should be culled. But this has to be data driven, not just because the animal is not recovering, but because of chronic infection and no response for treatment. So data is the most important part in the dairy industry. So key takeaways from this are subclinical mastitis is a dual threat, an invisible thief that delivers a 1-2 punch. It directly cuts milk yield by damaging udder tissue and impairs reproductive performance by causing systemic inflammation. And an economic drain, subclinical mastitis accounts for approximately 75% of all mastitis costs. These hidden losses are driven by lost production, reduced fertility, higher replacement rates, and consistent monitoring and prevention are essential for herd profitability. So these are the key takeaways that we take from subclinical mastitis. So when we come to diagnostics and treatments, so to check subclinical mastitis, the ones that we talked about earlier, for example, to check the clinical mastitis, it's easier. We can do gram staining, and then we can identify which bacteria is there. But to do the subclinical mastitis, we really need to do counting because this is not detectable. So we need to have this. This is a DeLavo somatic cell counter, and then there's the Malditov. The Malditov is a sophisticated laboratory equipment. So maybe that's not actually practical at a dairy farm level or at a clinical level, but at a national level, maybe when there is a research team in place to do assessment and then report back on how much this is, you can use the Malditov. Then there's the CMT. I think in CMT is the easiest when it comes to our country and different countries. Easy to detect, easy to use, and anyone can use it. You don't have to be a vet, but you can train the farmers to do it themselves and record the information. The vet needs the data and to make data-driven decisions, so they need to record the data accordingly, even if for the CMT. And there is the master test. This has been used in many countries. It's a bit complicated. So the master test actually replaces the culturing because you don't need to culture if you are using a master test. So the master test, I think in Zambia, they have a good dairy industry from experience. I'm not saying it's one of the best in the world, but from my experience in Zambia, they use the master test to detect subclinical mastitis because there is packages for different milk premiums. So the master test actually is a good equipment and tool to detect subclinical mastitis. So when we go to treatment, we have mastitis earlier when we said mild or mild one, you can treat it with intramammary infusion. And when it becomes moderate and severe, you can use Ashinero, Ashiken. These are antibiotics, enrofloxacin, gentamicin. In Ethiopia, people have been actually trying to use gentamicin sulfate itself, just the ampule, by breaking it and putting it into the in as an intramammary infusion. So in many parts, they complain that there is a lack of this intramammary infusion. And then these medications can actually support, Ashinero can support in therapy of mastitis, especially if it's a systemic one, and also if it's the severe one, we can use it because we cannot only use it in the udder itself when it becomes moderate and severe. These two level grades actually need a systemic or a parenteral antibiotic therapy. So we can use Ashinero, we can use Ashigen 10%. There's also a possibility of using Ashoxi. These are available in Ashish Life Science. And then there's the 10%, the 20%, the 5%, and then Ashitile is also there. So these are products that we can actually use to intervene with. Uh, we can use parenterally through the intramuscular injection to control the systemic and the severe. And the other one is the intramammary antibiotic therapy, the Meljet. I think it's the ampicillin, sodium and cloxacillin, sodium intramammary infusion. So it's a kind of multi-drug therapy for the for the intramammary infusion itself. So we can use these as a treatment, and always we recommend, because mastitis is a very dangerous, neglected, often considered as I can just cull the animal at any time kind of disease. We really need to focus on preventing the mastitis and then actually increasing the milk quality itself, and then reaching for um, better production. And one of the things that we need to do is whenever we're uh, providing for parenteral therapy or intramuscular therapy for for moderate and for severe mastitis, we don't need to forget that we need to provide anti-inflammatory therapy at the same time. This can be used. These two products like Meloxicam and Flunax can be used to actually reduce the swelling in the udder. So these are also some of the products that we can actually use. And then the no shock also is chloramphenicol malate. So then we can also use this antihistaminic therapy, so that we can break down the cascade, the inflammatory cascade that's happening in the udder. And vitamin, we can support them. This you can provide actually when for example, when we have doubts about the animal feed that's being produced, we actually use these kind of multivitamins to actually improve the animal's immunity to fight against the bacteria or any other fungi or yeast that's coming into the udder. So basically, that's what we can do. The other one is the topical application Heal O Fast Spray. So we can also use that one for topical ones. And that's it from my side. Then if you have any questions, I'll listen and take them. Thank you very much.
Thank you very much, Dr. Ebenezer. In the chat box, many people are appreciating your effort, appreciating your presentation. So actually, the presentation was extremely insightful, and it was an kind of a practical session. I mean, like you have clearly walked us through the mastitis in its clinical and subclinical forms, and also more importantly, you have highlighted how udder health failures silently drain farm profitability through reduced milk yield, poor milk quality, then treatment costs and long-term herd damage. So, like what we personally appreciate is the way you connected science with farm economics and real-life decision makings. So these are exactly the kind of insights that helps both veterinarians and also farmers, like to move from a reactive treatment to preventive management. So, like, I would also like to sincerely thank all the participants for staying engaged and actively listening. So there has been some questions in the chat box. I'll just read out the question. After that, you may give the answers for that, Doctor. So, Tagesu Abdisa has asked, thank you so much. Can viral cause mastitis? Doctor, am I audible? Hello, Doc?
Can you see my video?
Yes, yes, yes. We can see.
Yes. Okay.
Uh, thank-
Um,
okay.
okay. Uh, Let me go through the questions. Sorry. I was trying to connect the video because I was
Okay.
disconnected.
The question is like Tagesu Abdisa has asked, can viral cause mastitis?
Okay. And other question?
So maybe I think we you can answer one by one. Once you finish one question, and once you finish answering one question, I'll give the or I can ask you the next question.
Okay. Majorly, the ones that the virus is not a kind of inflammatory. Sorry, I'm trying to fix the camera. Um, I don't think you need to see my face. So I'm having a hard time with.
Now you're till this time you are completely visible. Now we cannot see you, but if some
Okay.
issue is there, means we can continue with the camera if that is okay with you.
Okay. Sometimes they do contribute, but it's not always. But the major causes that actually, these are not the major factors that actually cause the mastitis itself. They do in some cases, in some occasions, like in bovine herpes virus, they can actually lead to mastitis, the BHV1 and BHV4, and also the foot and mouth disease, like I mentioned earlier. They can actually, what do you call it? They can support the occurrence of mastitis, but necessarily not cause mastitis itself, but they can be the factors that actually cause mastitis, if I answered that correctly.
Yes, doctor, that is clear. So, just before continuing the discussion, before we concluding, I just need to tell that all attendees will be receiving an e-certificate of participation. And once you complete the entire session, so you may not just cut your call and or maybe disconnect from this webinar and go. Just stay till the end of the webinar, and we'll be announcing our three lucky winners also shortly. So once we complete the session, once we complete the discussion, those who have the complete attendance only will be considered for the lucky winners. I mean the lucky wheel spin or the lucky winner selection. So everybody, please stay on the webinar, stay on the call for maybe once we discuss and finish all the doubts. So, another question asked by Sisei Velegebereit was that do you have a prior info about the presence of Ethiopian subclinical mastitis test reagent invented in Ethiopia by Dr. Sisei Velgeberiel Zivald, a published and already in the marketplace? Hello, doctor. I think your mic is off. We are not able to hear you.
Okay, so I was just reading, I think Cesar Gabriel's. Um, I think we used. I'm not sure who produced it, but it's good to hear. I think we used the reagents invented in Ethiopia by Dr. Sista Yewalde Gabriel Zawald. I think we used your products. I worked with a master's degree student who came to work with me when I was in Alpha Fodder Dairy Farms. I think she brought that reagent with her to do the some the to use the reagent. I think if I'm not wrong, I think I know that reagent.
Okay, then Dr. Geshagen Chewaka has asked, can somatic cell count increase due to factors other than pathogens or infections? If so, how can such cases be differentiated from infectious cases?
I think yes. Yes, they definitely can be increased due to because somatic cell count means the neutrophil count in the milk. If there is a systemic infection, there's possible, but um, when we treat the systemic infection, then we can actually then I think if the systemic issue is resolved and the somatic cell count decreases without intramammary infusions, that way we can actually differentiate the two. But it's just a neutrophil count, so they could be found in the udder itself too. I think Dr. Sisai, thank you for sharing the publication.
Yeah, Dr. Sisa has shared the publication. And Dr. Bezavit has asked, I think it's an error when it is arrested as endotoxin as part of gram-positive bacteria cell wall, but better to be corrected as for gram-negative.
Yes, we actually, I said that earlier in the presentation, Dr. Abid. It
Yes, I
was
remember.
supposed to be Dr. Bezai, thank you. That was supposed to be G negative, but it was during editing, it was made G positive. So you can see when you receive the PowerPoint, you'll see an
We'll
edited.
change that, and once we send the presentation to all the participants and people who have registered, we'll correct it and we'll send it.
Good.
So, Yared Belet has asked, is there any traditional practices you notice that a farmer should consider not doing?
Um, if I have to say it, in Ethiopia, yeah, a lot. Not traditional, but modern plus traditional. The treatments that are being provided for animals are modern, but the system that they're being administered with is traditional. For example, intramammary infusion is supposed to be given twice a day within 12 hours difference for 3 to 5 days. But basically, most farmers do one day, and then when they see progress in the second day, they stop the intramammary infusion and they keep it um, for for the next infection or for the next infected animal because of cost and availability and all those things. So basically, these are some of the traditional things. The other thing is and in Ethiopia, one of the things that I want to mention to everyone is that due to the high cost of veterinarians, people are actually injecting without consulting veterinarians. At least consultation is free. For example, when you come to our clinic, our veterinary service, farmer consultation is free, especially related to medications and all those things. Farmer consultation is free. Those traditional things that people just inject oxytetracycline with pen strip without understanding the synergy and antagonistic and agonistic effects that they can bring. People are actually using those ways of traditional mindsets where you can put everything and try and error method. So those I think these are the things that we really need to work on when it comes to traditional practices. So I call them traditional plus modern practices. So yeah. But I think Dr. Bezawit said, I'm sorry, during the presentation, I saw gram-positive bacteria has endotoxin. No, it's gram-negative. It was a presentation editing error, so we'll correct that one.
Yeah.
I mentioned that one earlier. Um,
Then Yasin Yamar has asked, thank you for your nice presentation. I am Yasin from Ethiopia. Where can I get Meljet intramammary infusion? So, Mr. Yasin, once this webinar is over, our concerned veterinary sales managers from Ashish Life Science will be contacting you. We do have your contact details, so that will be shared with them, and they'll give you all the necessary details for all the products that we have in Ethiopia, or what all requirements that you have, that will be contacted by our concerned VSMs or our sales managers to you, right? So Ashlew Yenu has asked, is somatic cell count greater than 2 lakh cells per ml indicates subclinical mastitis in other dairy animals like goat and camel?
mm, I'm not sure. I have to read on that because basically I haven't worked in that part of the dairy industry. And it's not common one, but I think I can give you um, my contact, and then you can we can discuss if it actually affects. But I think in goats, yeah, but in camel, I'm not sure.
Okay, then Sise has also asked, my second question is where, and doctor, maybe we can do one thing for such questions which needs bit more clarity, or like which maybe we need to refer and give the answers. We can once we send the presentations, we can just ask, I mean, add that questions, and we can paste the answers for that, and we can share it with everyone. That also can be done. And Sise has asked, my second question is, where and how can we get or access the therapeutic things you mentioned in Ethiopia, especially in remote regions like Tigray? So regarding that also, already our team in Ethiopia, even including the country manager, national sales manager, everybody is attending the session. So they'll be definitely contacting you for all those things, and we have already collected all your details, or we have all your details with us. So with your details, you will be contacted and you will be addressed according to your request. Fine. So, Yalev has asked, using iodine frequently for teeth dipping may cause infection, as stated before. What other disinfectant can be used as an option for dipping?
Not using iodine, Mr. Yalev, it's the improper concentration. Actually, iodine does not cause damage, but it causes dryness when it's, the concentration is not properly done. So it doesn't actually cause the teeth damage if it's properly used. But I think with the PowerPoint, Dr. Abid will share my contact too. So what we have done is we currently we're actually working with on a single farm to use to generate practical data. We also, as a veterinary service provider, we're actually using a cream that's used actually made from herbs in our clinic to actually moisten and also serve as an anti-inflammatory reagent in places like this. So, like after iodine dipping, you just rub the teats and also the udder with that cream, and it just protects from desiccation. So desiccation plus anti-inflammatory plus yeah, preventive effect. So you can contact me and you can actually try those creams, and then maybe just to smoothen, because mastitis happens not because of chemical. This is when I said iodine I didn't mean iodine causes it, but chemicals like iodine, if not properly prepared with a proper concentration in the system, they can cause desiccation of the skin around the teeth. So that causes during milking, that causes actually kind of bleeding, and then that results in non-infectious cause of kind of traumatic lesion. Then that results in entry of bacteria. So use of different chemicals has to be properly managed by a professional. Plus, to just smoothen it, you can use a cream, and then that will help you. So I believe I answered that one properly.
Yes, 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 doctor. So, like vote 2 has asked, I saw a tired like worms in the milk at time of milking. What is that?
Tired like worms.
Yeah, maybe
Okay,
tired
so
or maybe
okay. I think what ito yung kalapacho was it? Okay. Um, a worm. Is it a worm, or when you milk it? Because you have to make it clear. When you milk it, the kind of worm-like thing came out. That means that's a flake. It's a flake, the flake of milk. Sometimes it comes in the teeth, from the teeth canal. It looks like a worm. When you milk it, it comes out like a worm when you squirt it. Maybe that's but I have never seen worms in the milk canal or anywhere. And also,
you told it maybe the flakes that has been caused due to mastitis, which he might have
mhm,
confused with worms, as you said.
yeah, they do resemble, like they do have a resemblance with worms.
Yes. Maybe in
Um,
advanced cases, maybe it has been, he might have misdiagnosed this as a worm. It might be
yeah,
fix itself, yeah.
uh, you know, it's like when the flake is too much.
Yeah.
When the flakes are too much, they actually, when you milk them, um, they look like what do you call it? Worms, small worms or white worms, because the flakes come out like worms, the worms themselves.
Yes. So, Askelov has asked, what does it mean by blanket therapy in trichotherapy?
Um, So blanket therapy, so two ways. Blanket therapy is just overall dry off therapy for all the dry off cows. And selective therapy is just selecting some of the affected ones, the ones that we fear are prone to post post delivery uh, mastitis causes, mastitis cases. Selective, we select based on data. For example, if the resources are scarce in where we worked, when the resources are very scarce, when we cannot find enough um, dry cow therapy, we select the ones that are prone, the ones that have higher somatic cell count. Before drying them off, we give them selected therapy. Selective therapy means we even select the quarters themselves, but if it's blanket, we just give all quarters the dry cow therapy. Mostly, if the most economical one is the blanket one, because we need to give every dry off cow, because there is a leftover milk with bacteria in it, natural bacteria in it, so that if we don't provide with dry cow therapy, then it can result in mastitis.
Okay, doctor. So, Adugna has asked, why is the withdrawal period for an intramammary antibiotic often longer in a cow with systemic clinical mastitis compared to a cow being treated for subclinical mastitis?
The withdrawal period is a standard. Um, But the difference is when systemic clinical mastitis, severe, longer, uh, systemic clinical mastitis happens, you treat them for at least 3 to 5 days. So if it's 5 days, then the rest of depends on the drug itself. I used amoxicillin with clavulanic acid before. I think that was 5, 6 years ago. It's called I think yeah, Sinolox. So but so that one had 5 day withdrawal period after treatment, but not all the medications have the same withdrawal period. So it depends on the type of medication that we're using and on the standard that's actually put there on on the dry cow therapy itself. Sorry, in the on the intramammary therapy itself. So but during when treating subclinical mastitis, we focus on providing the treatment during the dry off period because we're economically not that strong when it comes to dumping the milk of a subclinical mastitis case. So we focus on dry cow therapy because 75%. So that's why it has more prevalence than the clinical mastitis. Clinical mastitis we can withdraw not because of only the medication itself, because the milk is actually flaky and it's like yogurt like. So you have to uh, then you have to actually focus on uh, dry period. But because you cannot use the clinical mastitis milk, but you can still use the subclinical mastitis milk. So it's economically not practical. So we do it on dry cow therapy on dry off period. But if we're talking about premium milk system, then we treat them when we dump the milk entirely. So we check the bulk tank and then we dump the milk. The subclinical mastitis withdrawal period is going to be low because it's 3 days treatment, and then after that's going to be a bit less. So that's what I. Is regular somatic cell count testing economically feasible and accessible to smallholder dairy farms in our country scenario? Asjalo, it's not. The big ones are not. The big kind of for example, the SCC, the level counter, even importing the cassette is very expensive. The master test is expensive. The Malditov is even in Ethiopia, it's not even practical, not practical, unthinkable, I think. But the CMT is practical. The CMT at least 3 times, 3 to 4 times a week, checking the bulk tank plus every quarter is practical. So that I can suggest for farmers in Ethiopia.
Dr. Bezavit has told, thanks, Dr. Ebenezer, so much. And Kedir Ahmed has asked, can you share us the PPT, please? Yes, Kedir, once we are done with this webinar, once we finish this webinar, as we have discussed, we have some minor additions in that and some Q&A and that gram negative 2 additions that we have to do. Once we do that, all the participants will be receiving the presentations. And Tagesu has told, okay, thank you, doctor. Viral infectious disease can cause the lesions on the teeth and udder. The secondary bacterial infections again may cause the inflammatory complications. Indirectly, virus may contribute for occurrence of mastitis. Thank you so much. Really, I like this valuable webinar on the udder health and management. Thank you, Tagesu, for your valuable feedback. Then Seful has asked, do we have gentamicin-based intramammary infusions on the market?
Currently, no. But I think I have talked to importers from Ethiopia. They're actually going to import Meljet. It's on the final process, so it's better to use the Meljet with the cloxacillin, ampicillin with cloxacillin. Gentamicin is No, not available. Even not currently not being used that much. So I don't think so. Most of the time it's ampicillin, cloxacillin, and amoxicillin. These are the ones that actually can be used.
Yeah. Yasin has asked also, where can I get mineral block in Ethiopia?
Um, try to contact me. I'm not sure, but I used to purchase a mineral block for because I worked in South Omo with Luna Export as a head of livestock supervisor, livestock department. So I used to purchase them, but I made those purchases based on a phone call. I'll check where they got them from. So. I'll let you have the phone number. That's okay.
Okay, Doc. Robert Zulu has told a very educative session, and he has asked, is the use of lubricants such as Vaseline advisable?
Um,
He means
yeah,
applying Vaseline on
yeah.
teats before milking.
After milking, mostly after milking, and but not Vaseline. So the challenges facing the challenges, we actually have a partner working on a lubricant made from herbs that have actually different effects. So if you guys can try that, and we can give you for free and just check it. It's just a lubricant from herbs, which actually repels flies and all those things. So that could be something that you can use. But you can also use Vaseline after milking, after dipping it with iodine, and then let it dry a little bit, and then you can just massage it. Or sometimes before milking if it's very dry.
Okay, Doc. Then Avaris has asked, is it possible to inject antibiotic like Penistrip or Oxy through teeth like intramammary? Because I have seen many professionals did that by teeth cannula.
Mm, I cannot. I'm not. I'm not a pharmaceutical producing company, but we tried it. I'm not gonna lie. We tried it because we ran out of intramammary infusions. We were suffering from mastitis. We tried procaine penicillin with dexamethasone. One of the challenges that we faced was those medications were made for actually for parenteral administration. So the withdrawal period, because in a company that I worked, the drug withdrawal period is critical. Plus, you cannot milk an animal that's actually on medication because the whatever milk you have, it will be immediately dumped. So, for example, it happened. So we thought procaine penicillin was okay, and we normally took it for Sinolox, and then just applied it. It did treat a little bit, but we took the with the withdrawal period in 7 days, and then just out of doubt, and after the eighth day, the animal was actively actually with antibiotic. So we dumped more than 7,000 liters of milk because of antibiotic positive result. So I wouldn't recommend it, to be honest, because you don't know how long. Because from principal perspective, the cow is owned by the farmer, but the milk goes to the community. So drug withdrawal is a critical thing that we really need to focus on because it has many hazard to the community itself. So we really need to think of using only these practical things. But if we use it out of lack of access to other intramammary infusions, if we use it, then we have to really be critical on the withdrawal period. It has to be at least 14 to 15 days. So penicillin usually is used, in a preparation called the Orbenin extra as a dry cup therapy. because it stays longer in the udder. So basically, that's one of the things that uh, we face. I think we really need to uh, be very careful with that. I did it once, and that we suffered the consequences. So I wouldn't do it to keep the community healthy. I wouldn't do it. But if there's no option, then do it. Then keep the withdrawal period at least to 15 to 18 days. So that's what I would suggest. But I mean, Dr. Abid,
Yeah.
can you can promise us we will have soon milk jets in the market. So I think it's better to push that one and then bring that into the market.
Yes, yes, doc. Our Ethiopian team will definitely work on that. Thanks for the suggestion. So it's better, always better to go with the intramammary infusions like Meljet because rather than giving the parenteral injections intramammarily, it would be always better to go with the intramammary infusions or intramammary preparations itself. Yeah, so like Sise has asked, I need to meet this smart guy, Dr. Abhinay via cell phone and get some chemicals from Ashish Life Science. So our team will be definitely contacting you, and he has given his number so that I will share with Dr. Abhinay sir. I am not making it public. So, like, one more question has, I do have one more question. Why did the pH of milk become alkaline during mastitis? I want to know the reason why it shifted to alkaline. Thank you in advance.
Alkaline. Alkaline. Um, yeah, I gotta be honest with you. I don't know why. The why is a bit a tricky question, but I don't know. But we can research together. You can contact me. I think Dr. Abid, what you can
Yeah.
do is you can share my number on with the PowerPoint, and people
Yes.
can contact me whenever they want.
Yes, sure, sure, sure. Yeah.
Okay.
So I think we have left with two, three more questions. Annie has asked, so what is the withdrawal period if you give intramammary tubes?
Um, No, like I said earlier, it depends on the kind of drug and also on for me, it was 3 to 4 days. The one that I used former was called the Sinolox. So it usually came from the Netherlands. So that's what we used to 3 to 4 days was but I'm not sure about the milk jet, but I think a bit you can add that one on the PowerPoint too, like on the withdrawal period, because you have the catalog for the milk jet. And Rashid, what is the drug of choice for clinical mastitis? It depends where you are, but I think the best choice now we have is the milk jet that we're waiting on. So
Yes, yes, yes. So, maybe one another question from Dr. Beswith is, can we conclude that the milk from subclinical mastitis patient could bring zoonotic diseases as Staph aureus is the one mentioned associatedly?
Staph aureus is everywhere on our hands. It's a very one of the smartest bacteria. Actually, through time, they developed a biofilm so that we can actually not uh, like we cannot say it's a zoonotic one. They're opportunistic when they find the opportunity to enter into the teeth canal or into our system. Maybe they do, but directly through ingestion or through drinking the milk, we cannot say they present themselves as a zoonosis because there are different zoonosis cases that we can talk about, but this is not one of the zoonotic diseases because Staph aureus is one of the bacteria that can be easily isolated from a hunt of a milker. So basically, that's why we actually suggest um, putting on gloves during milking instead of milking with hands. However, you wash them, uh, in Ghent University in Belgium, there were we had a demonstration of the culture of the hand, even after washing it with different disinfectants. There was still a bacterial colony that made from the hand itself, even after washing it thoroughly. You cannot reduce the the bacteria. So the isolation was Staph aureus. So I wouldn't say it's zoonotic disease because they're opportunistic. They're not actually that kind of those kind of diseases. So I would say we cannot conclude that it's zoonosis, but we give it to them too. So we have to be really careful on milking because it's hand transmitted the Staph aureus. Okay, anonymous attendee. Okay, thank you for organizing such an important and informative lecture. I really appreciate the way you present, Dr. Ebenezer presented, and the way you lead the program. Same as kindly request you share contact address of the presenter and yours for further communication. Thank you once again. Thank you very much.
That will be shared. So I think, Doctor, we'll wind up the question and answer session. One of another person has told, I appreciate you for the nice presentation and the way you are presenting to questions. So there are different appreciation messages also that is coming. And I think this would be the last question. And Rashid has asked, what is the drug of choice for clinical mastitis? And after this, we'll go to our selection of our lucky winners.
Drug clinical mastitis,
Yes. What is the drug of choice for clinical mastitis?
drug of choice.
Yeah, that's an. I was
Yeah,
expecting this question because this is a very big question to answer. There are
yeah.
multiple factors here.
Okay, so let's do. Okay, once you get the PowerPoint presentation, then you'll see the grade of mastitis. So if it's a mild one, intramammary infusion. If it's intramammary infusion like melt jet, and if it's not mild, and then if it's grade 2 and grade 3, that's the moderate and the severe one. Then you can combine Inrofloxacin Ashinero with the melt jet itself. But make sure that you consult a veterinarian for agonistic and antagonistic effects before merging two medications together. So once you do that, I think these drugs can be one of the best treatments for clinical mastitis. But the clinical mastitis treatment has to be done, intramammary infusion has to be done. Usually people do it once a day, but it has to be done 12 hours difference and then twice a day after milking. So we milk the quarter that's affected, we empty it, then we expose, we remove all the pus and the flaky milk, and then we inject the intramammary so that it can reach to different parts of the udder itself. So the gland cistern and all those things. So basically after that, if it's moderate, then add inrofloxacin parenterally, and then that's the drug of choice that you can actually provide.
Okay, doctor. Thank you very much. So I think now we'll move on to the selection of our lucky winners who has completely attended our webinar. So shall we move to that then, doc?
Sure, we can.
Yeah. It will take another 2-3 minutes. So first we will select the third prize winner. There are like a lot of participants or a lot of attendees in the webinar. So we'll be doing or we'll be selecting it on live so you can see the screen. So we'll go with the third prize winner now. So let's do the lucky spin. Yeah, congratulations, Charmaine Sashirera. So our countries, from where the Sharmain has, we all have all the details of all the registered participants and attendees. So our particular country business team, the sales team will be contacting you, and they'll be giving you the prize for the lucky winner. So Sharmain Sashirera has been awarded or has been selected for the third prize winner. So now we will move on to the second prize winner, second lucky winner for the webinar. So congratulations, Vance McConnell. So Vance has been awarded the second prize for our webinar, the lucky winner. So Vance also will be contacted by our country's team, and you will be awarded with the prize. So congratulations once again, and we'll go to the most awaited first prize winner. So let's do the lucky spin. So congratulations, Kampe Amuel Dakuyo. So congrats, Kampe. You have been this winner for the lucky wheel spin of our webinar. You have been the first prize winner. So congratulations, and to all the other attendees, please don't feel bad for this, because this time these three people are selected. So we will be conducting webinars in all the upcoming months. We'll be conducting different webinars on livestock, poultry, companion animals, and different topics which will be related to veterinarians, farmers, and all. So all the attendees in the upcoming sessions also, please ensure your participation. And people who has not got any prize in this, need not worry. Next webinar will be yours. So ensure your participations in that. So our concerned country VSMs, veterinary sales managers, will be contacting you for giving you the prizes. So Dr. Abhinay sir, I think then we may wind up the session. So anything
Okay.
else you want to say?
Thank you for all the attendees and for all participants who participated. And thank you for Dr. Abid and the Ashish team, the Ashish Life Science team, for inviting me to be a guest speaker on your webinar.
Okay, thank you, Doctor. So it has been a wonderful presentation. It has been very informative. So there were a lot of questions that has been asked by different attendees, and you have answered them all very beautifully, and all the points are very clear. And we'll be sharing the presentations after we do all the additions. So I thank you on the behalf of Ashish Life Science from all of us. And thanks for the beautiful presentations. And in the future also, let us do such more presentations and webinars and upcoming times. And I personally thank all the participants who has joined and attended this webinar and completely attended this webinar, has been active and participating very actively. And so, it has been a very wonderful session for both of us, for all of us. And Dr. Chakalingam has like he only gave me the contact of you, who is our country head in Ethiopia. So I thank him also on my behalf for suggesting you, and that was a perfect suggestion for like doing an webinar to be a key speaker in our webinar. So I once again thanks everyone, and I think we'll conclude the session. And thank you all the participants. So see you on upcoming sessions. The presentations will be shared with you very soon, and you will also be receiving certificates of participations also very soon, e-certificates for that. So let us wind up the session. So always ensure participation in our future upcoming sessions also, which would be very fruitful, which would be very helpful for both veterinarians and farmers. So I thank once again to everyone. And so okay, then bye bye. Good day to everyone. Bye bye. See you.
See you. Good day.
Good day.